stuff in it, right? There's various things in it. And as you add solute to a solution, you increase its specific gravity. All right, so now the specific gravity varies depending on what's in there. It also varies with age. For example, neonates, newborns, and infants will have a low specific gravity. It'll be greater than 1, but it'll be somewhere around maybe 1.002 to 1.004, something like that. It's going to be low. But for our purposes, the adult number is what we're going to deal with. Now, it depends on what lab you're in and what source you're reading, but for our purposes, we're going to give the range of adult specific gravity as somewhere between 1 point, so specific gravity of urine, and we will say that we're using the adult numbers, is somewhere between here and here. Now, I've been on your cases all semester to put the units with a number of a result, ever. So I told you when we talked about hematocrit to put a percent. When I talked about total red blood cell count, so many millions per cubic millimeter, right? Always put the units. Here's the exception. Specific gravity has no units. All right, so I'll just put this out here. No units. But to write it correctly, you need to put 4 digits. A 1, a decimal, and 3 digits. Just like that. All right? Now, let's go down this pathologic column here, by the way, and just compare. So as to color, and I'm sort of combining clarity in here too, if it's, not clear, something's wrong. So it could be cloudy, it could be milky, depending on what's in there. Fat, blood, mucus, lots of epithelial cells, and so forth.
Excuse me, sir. When you say clear, what does that mean? Does it relate to the yellowish color or other content in it?
No. Like, we would say that's clear. Well, it's almost kind of cloudy to me, but if the yellow color is clear,
it's normal.
It's clear. That's normal. Okay. But if it's cloudy or turbid or discolored and changing its color, then that's affecting the clarity of it.
Because sometimes when you are overworked and then you try to PP, the color changes to.
When you what?
When you are stressed, or maybe when you are overworked, maybe due to heat in your body.
When you're dehydrated,
is
the
that what
color gets darker.
Okay.
That doesn't necessarily mean it's not going to be clear.
Okay.
But there are various colors that urine can change depending on what's in there. So I gave you some examples here. If it's dark yellow or orange, you could have low fluid intake. You could be dehydrated. But certain vitamins will do this. Carotene will do it. Certain medications will do it. For example, for the treatment of acute cystitis, which commonly affects women, it's a very disabling disease. It's very painful, but you treat that with an antibiotic, and to relieve the spasm until the infection is cleared, you often associate that giving another drug like pyridium. Pyridium relieves smooth muscle spasm of the bladder. Okay, but it colors the urine dark orange. It's innocuous. It just colors the urine orange. It's innocuous. sometimes the urine can be dark brown or dark yellow or green. What can cause that? Excess bilirubin or bile in the urine will do that, as in biliary obstruction. In other words, if that bile is backing, if it's not flowing freely into the intestinal tract and it's backing up under pressure, it's going to move into the bloodstream, and that pigment is going to be intense in the bloodstream, and it's going to show up as changing the color of urine quite significantly. So biliary obstruction will do it, certain antibiotics will do it, certain chemotherapy drugs will do it. Hemoglobin in the urine, if you have a significant amount of hemoglobin in the urine, it will tend to turn the urine brown. So for example, in a high voltage electrical burn, you have massive soft tissue injury, and you destroy so much tissue, and you essentially cook blood within blood vessels. And so that obviously lyses millions of red blood cells, and they release their hemoglobin. And that heads to the kidney, and the kidney is going to secrete and excrete that hemoglobin in the urine. It's going to turn it brown. Sometimes there's so much hemoglobin there that it forms hemoglobin casts in the tubules of the urine and blocks urine output and creates acute renal failure. But anyway, hemoglobin in the urine is a grave prognostic sign when there's massive soft tissue injury like that. So if you have a pink or red color, beets will do it, blood will do it. It doesn't take a lot of blood to show up in the urine, you know. Now if you have a big container of urine and drop 1 drop of blood in there, it's not going to change it to 2 drops or maybe 3. It's not, you know, it's not going to make it all of a sudden red, but at least there's going to, if you take a sample of that urine and spin it down in a centrifuge and look at the sediment, you'll find red cells in there. But it may not be obvious just looking at the gross specimen. All right. Green or blue color. Artificial coloring in foods or drugs will do it. Some medications will do it. Methylene blue, a dye, will do it. Methylene blue is an innocuous dye, sometimes used in surgical procedures to mark things. It often will show up in the urine and give sort of a blue color. It's innocuous. Urogesic is another drug like Pyridium. Pyridium relieves smooth muscle spasm in the bladder. Urogesic does the same thing, but it happens to turn the urine blue instead of orange. Some infections will discolor the urine. For example, Pseudomonas aeruginosa will give the urine a greenish color. If you ever have occasion to treat a person with Pseudomonas infection in a wound and you're doing the dressing changes, you'll notice when you take those dressings off, there's going to be a blue-green stain on the gauze. That's just a byproduct of Pseudomonas aeruginosa infection. Asparagus will tend to turn the urine green too. Eat a lot of asparagus, you might get sort of a greenish color with some odor from doing that. All right, the volume we talked about, pigments we talked about. Now let's look at the pathologic components in urine. Over here on the left side, we saw some normal things that are in urine. Now we're going to see some things that are abnormal in urine. So glucose. Is it ever normal to have glucose in the urine?